I want to send in your SMSs. We're getting into our relationship corner now, and we're talking negotiating contraceptives and birth control in relationships. And to talk to me about this, I'm joined by Dr. Nienke van Schaik, who is a senior researcher at the Health Systems Trust. Doctor, thank you so much for joining us.
It's a pleasure. Thank you for having me.
Such an important discussion. Are couples having free and open discussions when it comes to using contraceptions and other birth control measures?
Sure. I think it depends very much on the couple. I'd like to think that it was, but I think certainly in the majority of cases it's the female in the relationship who makes the decision and who goes then to seek medical care or medical advice in terms of contraception.
And so not much of a shift in terms of men then saying, it is their responsibility as well to be in control of birth control?
I think, men have very few options at this stage. The only things that are really available is condoms and also a permanent method in terms of vasectomy. There's no real male contraceptive as such that's available on the market that can be used.
But are men open-minded, though, when it comes to using contraceptives that are perhaps meant for them?
Sure. I think men have I do think men have an idea about, being fertile and having, and interfering with their testosterone levels and potentially their sex drive, and I think it's quite scary for men.
Yeah. Well, I want to continue chatting to you, and I'll open up the lines as well. 0891 104 207. We're talking negotiating contraceptives and birth control in relationships. Chatting to Dr. Nienke van Schaik, senior researcher at the Health Systems Trust. Give me a call on 0891 104 207 or send your SMSs to 34701. You're on the Talk Shop on SAFM. I'm Naledi Molao, and it's 8:10. Still in conversation with Nienke van Schaik, or Dr. Nienke van Schaik, a senior researcher at the Health Systems Trust, talking about negotiating contraceptives and birth control in a relationship. Whose responsibility is it? Is it the man's or the woman's? Give me a call on 0891 104 207. That's 0891 104 207. Is there a need from a women's side to want to see men play some sort of role in terms of even making decisions around the contraceptives that they do use?
I think in terms of, a woman is the one who ultimately ends up, being pregnant, carrying the baby, having lifelong responsibility for the child. And I think so a lot of women feel that it needs to be their responsibility. They can't leave that decision, even if it were available, if more options were available to men, to leave that over to the man because it's something that they do have in their control. I think a lot of women would perhaps like to have a discussion with their partner, to say, well, what do you think, the best is for us, what we should use. But I think a lot of men also just feel that it is a woman's thing, and so don't even feel that women might, want an opinion on it in that particular relationship.
But I imagine that the conversation is easier to be had for married couples.
I imagine it is, you have more of a joint interest, you've known each other for longer, and these conversations, become something that, is of relevance to you both. Whereas I think in a new relationship or in a situation where, you in a very short relationship or one night stand, I think that doesn't really even come up. And it's much more difficult to talk about.
Yeah.
But
go ahead.
No, I was just going to say, I think, certainly in our country where we have, we have a lot of unwanted pregnancies, we have a lot of teenage pregnancies at the moment. 1 in 15 deliveries is to a girl under the age of 18. We've got very high termination of pregnancy rates, which really shows us that I think in general, even though women have quite a few options in our country in terms of contraception, that they're either, not able to or not wanting to access those services and that.
I always maybe attribute that to in certain areas, people just not having enough information about the options that are available to them. So talk to me about the methods of contraception that are available, specifically those that we don't talk about all that widely.
Well, there's one new method that's been available for, I think, since about April last year in South Africa, which is Implanon, which is an implant, which I think is a really nice, new, exciting option for the women in our country. It's essentially a small plastic rod that gets placed in the upper arm, and it releases hormones slowly over a period of 3 years. So quite a nice option because you don't, it means that it's a once-off. You don't need to think about it again for the next 3 years.
And that's a surgical procedure?
Well, well, it depends on how you define it, but generally it involves a small amount of local anesthetic being placed in, under the skin, and then the rod being sort of, I hesitate to use the word shot, but it's really, it's not really an injection, but you have a sort of a device that allows you to insert it under the skin. And, quite quick and easy. And when you take it out, again, a little bit of local anesthetic, a small incision, and the rod can be really easily removed, which means that it's a fantastic option because if you found it's something that's not working for you, unlike, you've perhaps gone for one of the injectable contraceptives, and those have sort of much longer lasting effects. And, you can't take it out once it's in. You've got to wait for it to finish its cycle. But with the implants, if it's not working for you, or if the side effects are, you can't, if then, are bad for you, then you take it out, and within a day or two, your hormone levels drop to normal, and your side effects and problems should disappear. So I think it's a really worthwhile and exciting option for our country, particularly, for example, amongst teenagers, amongst people who struggle to go regularly for an injection or to pick up their pills. So I'm happy. It really is a nice option.
Yeah. It sounds very futuristic.
But it's real and it's available and it's at all our facilities. I think, and actually in the areas, since they have released it in areas where they know about it, there's actually been a huge demand for it, far more than they actually expected. And I think there's a lot, I think it's very exciting to hear. But I think more women could ask for it. But if we look at certainly, a lot of women, particularly in the public health sector in which I'm working, will choose one of the two injectable contraceptives, so either the 3-month injection or the 2-month injection. Far fewer women use the pill. And then, for example, the intrauterine contraceptive device, which is available. Last year, I think only 42,000 were inserted in the country, which really is quite a low number when you look at...
That's the loop?
Yes.
Okay, but that's probably because people don't understand how the loop operates as well.
That's true, and I think a lot of people, there are quite a few sort of misconceptions and ideas about it that are wrong. Women always talk about, it can travel throughout your body, which is absolutely not true. Certainly the copper tea, which is the most readily available, it can give women slightly heavier periods, which some people don't like, but certainly it is a very good option. The Mirena is now also available in the public sector. That's the one which has some progesterone on it, so it has some hormonal side effects, and a lot of women it actually leads to lighter periods. That's also currently available in the public sector, which is quite nice. But certainly, again, it's one of the sort of what we call the long-acting reversible contraceptives, which means that, it's available, it provides you with protection for a long period of time, and it can be removed so that you have an instant sort of return to fertility if that's what you want, or if, it's not meeting your needs or requirements.
For couples that perhaps have different opinions when it comes to what they should be doing in bed and what they should be doing for birth control, how do you have that conversation? If perhaps you're a woman who'd like to be on some sort of contraceptive and the man is completely against it, how do you approach that conversation and have it be a constructive conversation?
Sure, it's a difficult question for me to answer. I haven't been in the situation, where I've been counseling patients for a number of years now, but certainly, I think, ultimately, it's a difficult one. It really depends on the power balance within that relationship, whether it is in fact negotiable.